What is diabetes and why is it dangerous for the elderly? Dear compatriots, today's conversation is very important. We will talk about diabetes, or type 2 diabetes. Especially for people over 65, this disease has a strong impact on the quality of life. But remember, diabetes is not the end of life. It is a call to change your lifestyle. Today you will learn the following. What is diabetes? How does it occur? Why is it more common among people over 65? At what stage does the disease become dangerous? What is diabetes? Diabetes is a condition in which the amount of sugar, glucose, in the blood is higher than normal. But this does not mean just eating too many sweets. The main reason, the hormone insulin in the body begins to function incorrectly. What is insulin? Insulin is a hormone secreted by the pancreas. Its function: transports sugar, glucose, from the bloodstream to the cells. The cells convert this sugar into energy. Energy is your ability to move, think, walk, and breathe. If insulin does not work properly, glucose stays in the blood. Result: sugar rises, blood thickens, blood vessels, kidneys, eyes, heart, and feet are damaged. Difference between type 1 and type 2. Type 1 diabetes begins in childhood. Insulin is needed for life. Type 2 diabetes develops in older people. This is the most common type among people aged 65 plus. In type 2 diabetes, insulin is produced, but the cells do not recognize it. This condition is called insulin resistance. This process develops gradually over the years. Statistics: diabetes among people aged 65 plus in the U.S. According to the American Diabetes Association, ADA, more than 28% of people over 65 have type 2 diabetes. 1 in every 3 seniors is in a pre-diabetic state. That is, they do not yet have full-blown diabetes, but their blood sugar is higher than normal. If measures are not taken in time, this prediabetes can also develop into a full-blown disease. What are the risks for people aged 65 plus? As you age, changes in the body increase your susceptibility to diabetes. 1. Metabolism slows down. Sugar is digested more slowly, accumulating in the body. 2. Cells become less responsive to insulin. This condition is called insulin resistance. 3. Less exercise, more stress, poor diet. These factors accelerate diabetes. 4. The body's regeneration slows down. Organs such as the kidneys, heart, and eyes recover slowly from the effects of diabetes. Why is diabetes dangerous? Type 2 diabetes is a silent disease. In many cases, it goes unnoticed for years. But it eats away at the body from the inside. If left uncontrolled, vision deteriorates, diabetic retinopathy, pain in the legs, and in severe cases, it can lead to amputation, cardiovascular disease, stroke, circulatory disorder, kidney failure. Therefore, people aged 65 plus should get a blood test for diabetes every year. Don't ignore the smallest signs in the body. Slow onset diabetes, specifically type 2. Often a person walks without knowing about this disease for 10 to 15 years. But if you pay attention to the signs, you can notice this disease early. Excessive thirst, frequent urination, hunger, weakness, blurred vision, slow healing of wounds, frequent cramps, mood swings, sudden weight loss, sometimes. If you have these, consult a doctor immediately. Is it possible to control diabetes at the age of 65 plus? Of course. Diabetes is not here to control your life. You can be here to control diabetes. For this, proper nutrition, constant monitoring of blood sugar levels, stress management, exercise and, if necessary, medication. How does diabetes develop? Do you know the causes and secrets of insulin resistance? 1. How does diabetes start? Diabetes, especially type 2, develops gradually. It doesn't develop overnight, but over years. The earliest stage is insulin resistance, or insulin resistance. 2. What is insulin resistance? Insulin is the key in the body. It opens the blood and lets glucose into the cells. But sometimes the cells stop responding to this key. The reason for this is sugary, fatty foods, inactivity, obesity, chronic stress. Result, there is insulin, but it doesn't work. The cells are starving. And glucose continues to accumulate in the blood. This condition is called prediabetes, that is, a step towards diabetes. 3. Let's look at the main causes of diabetes. Age factor. People over 65. Metabolism slows down. Cells do not respond to insulin. Muscles decrease. Fat accumulates. This is a natural process, but if controlled, the risk is reduced. B. Genetic predisposition. If your family, father, mother, sister, brother, grandmother, grandfather, has diabetes, you are also more likely to develop this disease. This is due to low insulin production, prone to inflammation, genes that quickly accumulate sugar. But remember, genes are not a sentence. They are a warning. See nutrition, hidden dangers. Did you know? The average American over the age of 65 eats 3 meals a day. A lot of bread and white carbohydrates. High sugar content in drinks. Fast food and canned food are widespread. All of this increases blood sugar and increases insulin resistance. D. Inactivity. Muscles are a storage for sugar. If the muscle does not work, sugar remains in the blood. Walking 20 to 30 minutes a day lowers blood sugar, increases insulin sensitivity, strengthens heart and brain health, stress and insomnia, and constant stress. The body releases a hormone called cortisol. This hormone increases sugar release, reduces insulin effectiveness, increases the need for food. Excessive sitting increases the risk of diabetes by 2 times. Tobacco and alcohol. Cigarettes narrow the blood vessels, making it difficult for insulin to pass. Alcohol causes blood sugar to suddenly drop and then rise too high. Both factors cause diabetes. 4. How do the signs appear in the body? Stage 1, insulin is normal, but the cell does not recognize it. Stage 2, the pancreas secretes more insulin. Stage 3, the gland gets tired, insulin production decreases. Stage 4, sugar is constantly high in the blood. This is full-fledged type 2 diabetes. 5. What does scientific research say? Harvard University study, observation of more than 50,000 people for 20 years. The risk of diabetes is reduced by 80% in those who eat healthily, exercise, and control their weight. According to the NIH, National Institutes of Health. In prediabetes, with the right lifestyle, it is possible to return to a healthy state in 3 years. Type 2 diabetes starts with signs you don't know. How to detect it early. Early detection of the disease is life-saving. It starts painlessly, without discomfort, and without being visible. However, if you know how to listen to your body will warn you about this disease in time. Early signs of type 2 diabetes. The following are the earliest and most common symptoms of type 2 diabetes. 1. Frequent urination. You go to the toilet frequently during the day, especially at night? This means there is too much sugar in the blood. The kidneys try to remove it. Urine increases. This is the first signal of diabetes. 2. Increased thirst. Do you constantly need to drink water? This is due to fluid loss through the kidneys. The body becomes dry, the mouth becomes dry. This is a sure sign of high blood sugar. 3. Excessive hunger, polyphagia. Not feeling full even after eating. The need to eat frequently. This is due to the body's inability to deliver energy to the cells. 4. Fatigue, weakness. Feeling tired all the time. Body feels heavy after lunch. Fatigue even when sleeping. This is a sign that glucose is having difficulty entering the cells. 5. Blurred vision. Blood vessels in the eyes swell due to sugar. Vision becomes blurry. Diabetes gradually worsens vision. 6. Slow wound healing. Cuts take a long time to heal. Even small scratches continue to bleed. Cause: high blood sugar reduces immunity and slows down the healing process. 7. Tingling and tingling in the hands and feet. This is a sign that the nerves are affected. Diabetic neuropathy. There is a feeling of tingling, mild pain, even numbness in the feet. 8. Dry and itchy skin, especially on the ankles, elbows and hands. This is a sign of fluid loss and inflammation. 2. When should you see a doctor immediately? If the following symptoms occur together: frequent urination, constant thirst, blurred vision, slow healing ulcers, sudden feeling of hunger and fatigue. This could mean that you have type 2 diabetes. 3. How to diagnose diabetes. Not only by symptoms, it is diagnosed through a blood test. The most important tests. 1. Fasting blood sugar, measurement of blood sugar on an empty stomach. Normal, 70 to 99 mg/dl. Prediabetes, 100 to 125 mg/dl. Diabetes, 126 mg/dl and above. This test is done on an empty stomach, in the morning. 2. HbA1c, glycosylated hemoglobin. This test shows the average blood sugar level over the last 2 to 3 months. Normal, up to 5.6%. Prediabetes, 5.7%, 6.4%. Diabetes, 6.5% and above. One of the most reliable diagnostic tests. 3. OGTT, oral glucose tolerance test. First, fasting blood sugar is measured. 75 grams of glucose is drunk. After 2 hours, the blood sugar level is measured again. This test is most useful in detecting prediabetes and latent diabetes. 4. Random blood sugar, measured at any time during the day. If it is above 200 mg/dl and there are symptoms, this indicates diabetes. 4. What are the next steps if diabetes is detected? The doctor will diagnose you, prediabetes or type 2 diabetes. He will teach you how to measure blood sugar at home with a glucometer. A diet and action plan will be drawn up. If necessary, medications, metformin, GLP-1, will be started. Additional tests, kidney, heart, eye tests. These special warning signs for the elderly. 65 plus years old. The symptoms are often mistaken for another disease. Blurred vision is called a sign of old age. Quick fatigue is thought to be age gone. But these signs may indicate diabetes. Diabetes in the elderly progresses slowly but strongly. For this reason, get a general blood test every 6 months. HbA1c, 1 to 2 times a year. A glucometer that measures blood sugar is a must. You have an organism that hears you. it is giving you a signal. Listen to him. Diabetes is a serious disease. But if it is controlled, there will be no complications. Remember, every complication is a warning. Every warning is a reason to take action. Every action improves the quality of life. If you like the video, don't forget to subscribe and like. Don't forget to share it with your loved ones.